This is the recorded lecture for Chapter 11. We're going to be talking about managing or building nursing management skills. So make sure it's recording. Yes, it is. Okay. So just a reminder, we talked about leadership, management style, but most importantly, this is just as important. Your nursing management skills are critical. They're very critical when you're managing or providing care. So we need those management skills in order to provide that care that is very safe. So should be able to communicate effectively. Again, if we're in a leadership role, we're supervising. We need those supervision skills to make sure that we delegate appropriately. And most importantly, as you can see here, our patient priorities. We got to prioritize the patient. So in order to do so, we look at those patients and we determine which client needs to be seen first. So this is how we prioritize. So we want to, after we go over this chapter, we're going to be able to effectively analyze effective communication as it relates to our patient safety. There's a team step tool. It's an evidence-based teamwork tool that we can use to help optimize our patient outcomes. And also, we're going to be looking at physician orders, making sure that we're transcribing those orders correctly, and also SBAR report when given shift change. So we need some form of communication that's organized, so that SBAR report is going to be very critical. And then again, like I said, delegation and supervision. Communication and patient safety, as I said, communication failures are leading cause of preventable patient death. So we've got to communicate, and we have to communicate effectively to improve patient outcomes. Again, we need that teamwork. It's very imperative when we're providing care based on the Nursing Practice Act. And then again, as I mentioned earlier, develop an evidence-based team system and that team step approach, and we're going to look at that. Basically, it's this team strategy and tools. It is used to enhance performance and patient safety. The goals: we want to reduce clinical errors. We want to improve patient outcomes. We want to improve process outcomes, patient satisfaction. We want to increase staff satisfaction as well, and we want to decrease those malpractice claims. So using that approach is very, very critical. And then, how can I improve my verbal communication for patient safety? One may ask that question. So again, make sure your orders, we'll communicate those orders verbatim. Um, Also, make sure that they're written down verbatim. I'm sorry. If a physician is present, a verbal order should only be accepted during an emergency or during a procedure. Otherwise, ask that physician to write down his or her order. So again, go back. Like I said, we want to make sure that we ask that physician to write down his or her order. I wanted to go back a minute to that team step approach. This was a study that was done by Joint Commission in 2010. They reported that communication failure was the contributing factor in about 80% of cases, adverse events. And also, Joint Commission study it indicated that the reason for those issues or adverse events was failure to or ineffectively use a process that will lead to the patient to prevent patient from being harmed. So again, this step, the result of that team step tool, it like I said, it enhanced patient safety and it also enhanced performance improvement. So again, the team step approach provides high quality, safer patient care. Like I said again, it was used to produce highly it was I mean I'm sorry, it was found to be highly effective in decreasing medical errors. Okay? Increase team awareness, clarify team roles and responsibility. Also, that team approach was step approach was used to resolve conflict and improve information sharing. And again, eliminating those barriers to quality and safe patient care. So again, that team step approach was very, very effective again, as I said, in decreasing errors. How can you most effectively improve your written communication? Good handwriting. Watch those abbreviation that you use. Write in ink. and then avoid any this will if you write something in pencil, somebody could erase it, and then they could transcribe the way he or she wants to be. Then if you write it down, don't scribble across it, just draw a straight line, cross out the error that you made. Only use a computer and print out information for communication. You don't want to print out information, have it lying around on the desk or carrying it home in your pocket. So you only use it, you only use a computer and print out for communication purposes. If you print something out, if you know from the computer, make sure you shred it, because again, we don't want to compromise patient confidentiality. Also avoid written communication and focus on verbal communication. Okay. So again, as far as written communication, patient safety, that it must be legible. And then as you've been taught, as far as when you're writing down numbers, avoid those trailing zeros when referring to numbers. Avoid any unapproved abbreviations. You want to provide written and verbal information to the patient in their native language to avoid any cultural variances. So again, in their language. So you may have to get a translator. Again, there are a lot of printed literature that is in one's culture, your patient's culture. So you want to make sure you provide that is culturally important. Again, what do you consider the most important element in transcribing physician order? Again, you want to avoid those unapproved abbreviations. They are unsafe. You want to read back those orders to verify for accuracy when you take transcribing physician orders. Again, the client's language, writing legible. And I'm again, those you want to avoid those trailing zeros. All orders must include the patient identifiers information. Y'all know that in the current date and time. Make sure it's implemented correctly, clearly understood and legible, not just for you, but anyone else having to carry out that order as well. If there's a discrepancy, you want to contact that physician or healthcare provider for clarification. Do not assume you want to clarify by contacting that healthcare provider. Read all your orders. Determine if all the request forms are available or applicable. Your labs, your medication, diagnostic tests. Make sure that all of this has been established. Review the entry. You have to go back. Follow your institution policies for rechecking orders and signing off. Okay? Also, you want to make sure when you transcribe an order, is this a one-time order? Or it's a PRN order? It's a standing order? Is this a stat order? If it's the one-time order, it's just for one time. You can't assume. You can't use that order over and over again. Computerized prescribed order entry. This electronic means of entering physician orders. Again, electronically, it helps reduces the medication errors it's associated with handwriting. So again, whenever that physician or healthcare provider, they need, whenever possible, they need to write their own order. Sign in integrated patient laboratory system. I'm sorry, integrated patient laboratory or diagnostic tests in the medication records. Again, most of your medications, we use electronic system. Again, diagnostic tests, we can pull up the diagnostic test results, patient laboratory results, and we also looking at those orders in the order entry system. You want to be able to communicate when it is critical, when it is critical, and what do I do when you get a critical lab value, patient test. You want to include any high and low results and diagnostic values. So in order to know that, you got to continue to monitor your client. You got to continue to look at your orders throughout the day. Particularly if the client has they were admitted with a high potassium or low potassium, and you've treated that high or low. You want to continuously to monitor results, because if they're getting medicine, you may have to increase the medicine or decrease the medicine. You may have to DC the medication. So again, you want to notify the physician of any critical tests and document your conversation. If that physician cannot be contacted, You definitely need to know your policy, your institution chain of command. Uh, who do I contact next? It may be the your nurse manager. It may be the medical director of that facility or whatever. Know the institutional policy. I'm sure most of you have been using, if you've had clinics, you've been using the IS-bar report as a handoff communication tool during your clinic experience. So if you have not used it, we need to talk about it. Then if you used it, did this tool, was it very helpful? Has it helped you stay organized? Did it help you manage your clients, your patients? Or did it help you prioritize your patient care and tasks? So again, what has been your experience with this ISBAR report, and how do you complete it? So this is basically communicating the critical. What do I do? Again, when you reporting doing your handoff report, you want to, like I said, you don't have to keep going back over like, things that are not that critical. So you want to, this is basically the report itself. It's a communication tool that reinforces the clinician's responsibility to provide accurate information and safe patient care. Again, you got the I, identification. Then you're looking at the situation. What is happening at the present time? Okay. Then the background. What are the circumstances leading up to the situation? Did this client fall? What was the background? Did they overdose? Just some examples. Then you assess, what do I think the problem is? What do you think contribute to the situation? Okay. Then recommendation. What should we do to correct? Now, what should you do to fix the problem? Then read back the response. Read back or response. The receiver acknowledged the information given, and what is the response? So you giving your report. So I'm receiving it. So I need to read back to clarify. Make sure we are on the same page. So prioritization. As we prioritize our care, what is your biggest problem in organizing the shift report? Sometimes I just can't get organized. My thoughts for the report, I'm just all over the place. I've had a bad day. So I just need, you try to follow the unit's procedures for giving the report rather than how was I taught to report. So get your system in place so you won't have problem prioritizing or getting organized, getting all the information together to give the report. Don't be fragmented. This is why I said earlier, using that SBAR report is a good tool to keep you organized. Okay? Again, these are some critical components, some things that you definitely need to add, including your shift report. Those identifiers, the typical name and date of birth. It's a typical. The diagnosis, the physician, who's the physician on the case, pertinent medical and social history, review of the system. This is where you're going over your head to toe assessment, focus assessment, resuscitation status. Is this a DNR or DNI? Do not resuscitate or do not intubate. And then the nutritional status. This is very important. Can this client have anything to eat or drink? Are they on any nutritional supplement? Okay. Any pending or critical issues or critical tests, giving me an opportunity. Okay, you need to make sure you monitor this client H&H. Okay, giving me some of the critical things that were going on. Bedside report. This is where you're going to do your change your shift reports. So much to say, so little time. So again, bedside report, it allows both the caregivers to examine the patient. So you giving the report at the bedside. So again, while the caregiver's there or the client. So it offers the family and the patient the opportunity to meet the incoming caregivers and keep them informed of the plan of care as well. So you can do this report at the bedside where you got the caregivers and the patient all together. Remember, patients are active members of their own healthcare team. So again, that's why you can do it at the bedside because they need to know, yes, I gave Miss Jones medication at 10 o'clock, or yes, Miss Jones blood pressure. They need to know this, okay? So again, how can I deal with all the interruption? Because when you got gonna have a lot of interruptions going on. Remain focused on the task at hand. Spend just a few minutes with no interruption to gather your thoughts and what is happening and what needs to be done next. Take a deep breath and just relax. This will allow you to be more productive, use your time more productively. Evidence has really proven and shown that medication administration shift reports are critical time to minimize interruption. So, you need to get in a quiet zone. around medication dispensing areas. Most in some facilities they have like a little box, a little red tape around the medication dispensing system, so no one can get close under you, so you will not be interrupted. Okay. Now let's talk about telephone skills. What skills do I need to use the telephone effectively? Say who you are. My name is Vera Davis. I'm an RN. Da 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 da. Say who you are right away. Do not apologize for calling. Okay, because I've known this. Sometimes when we call the doctor, they get upset because we calling them in the middle of the night. Okay, don't apologize for calling because you're calling that healthcare provider for their patient, about their patient. State your business briefly, but be complete. Ask for specific orders when appropriate. If you want the doctor to assess the patient, say so. I think someone needs to come and you need to come and assess this patient. Don't, like I said, be very direct. If the doctor's coming, ask when to expect him or her. So you can let the patient know. I did call your doctor. They'll be here in about 10, 15 minutes, whatever. If you get cut off, call back. I've told doctors in the middle of the night, they hang up on me, I call them right back. I said, I'm sorry that we lose connection. I'm calling you about patient and da 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 da. So don't be up apologetic. If you need to document, I tried to reach Dr. Jones at 10 o'clock, unsuccessful. If the doctor is rude and abusive, tell him and her so. I think, can you lower your tone or something like that? Just be very direct. Be professional also though. Okay? If you cannot reach a doctor or get what you need, always tell your manager. So again, you release responsibility. You documented, you've reported it, okay? What do you believe is most important in staying organized when you're caring for your patient? Like I said, going back to that flow sheet, keep a track of pertinent information. Delegate tasks to others, to unlicensed persons, because get burned out if you're trying to do everything by yourself. Maintain continuity of care by having the same patient, if possible. If you make an assignment, try to make that assignment so that nurse or that will have the same patient, because this will enhance continuity of care. And then again, you want to avoid any interruption if possible. So managing time in the clinical setting, you want to get organized before the shift report. Again, back to that flow sheet. Write down that important information that you need to coordinate your patient care with. Prioritizing your care. Remember Maslow's hierarchy of needs using your ABCD system. So get organized and then prioritize your care. And this is just a little three P's of nursing rounds: pain, position, and potty. Can you rate your pain for me? Then position. Can you turn on your side? This is just a little acronym, the nursing rounds. Then again, organizing your work by patient, multitasking. You sometimes we have several objectives that we have to do in one visit to the room. Make sure again, what I mean by that, if you know you're going into this room, you've done your rounds, or you got a report for me on it. Well, client got normal saline running at 125. There are 50. There for 200 cc's left in the bag of milliliter. Get multitask. Take you another bag with you, because if not, you're gonna go right back out of that room and get some saline, and then or whatever you need, have your your syringes, your alcohol prep or whatever in your pocket. 4x4. I mean, just things that you can put in your pocket so you keep you organized. Going down to the room, you got to restart an IV. You go down there with one gel coat. Take you two, because hopefully you get it on the first attempt, but you may not, so you don't have to go back out of the room and get another gel coat. So just get organized, okay? Then again, you want to make sure you managing others. If you're working with others of the team, you make sure you communicate very and delegate. Communicate, delegate. Use assertive techniques when you communicate. When you're managing others. You got to be direct. If you tell the unlicensed person, I want this client needs to be ambulated, ambulate 20 feet with a safety belt. Be very specific. Don't just say ambulate. Ambulate with assistance. Be very specific as much as possible. So this is just some questions. You can look at those. What is your biggest time waste in the clinical setting? So just this is all could be personable. What about delegating and time management? Know your state Nursing Practice Act regulation in your state. What can and cannot delegate? Delegate stable patients with predictable progress first. You want to delegate tasks such as feeding, bathing, and like I said, to that unlicensed assisted personnel. You want to be able to use your time wisely. I'm not saying that feeding the patient not using time wisely, but you for the most critical needs, things that you can't delegate. So again, like I said, you want to delegate those that because you could get burned out. Patient teaching and discharge teaching planning. This is responsibility of the RN. You cannot delegate that to an unlicensed assisted person. Discharge and patient teaching or an LPN has to be that of an RN. Supervising and evaluating the care provided by others. Like I said, when you supervise somebody, you want to give direction. You want to give clear direction in, detailing what you want done. Evaluation, follow up. Again, that RN has to follow up to make sure that those nursing tasks have been delegated to the appropriate personnel. So again, and I think I've already kind of mentioned this, when you delegating, give clear directions. Make sure that the task is being performed. Monitor those tasks performed. You have to intervene as necessary. You got to evaluate the task, the status of the client after those tasks have been uh, performed. And then you may have to give feedback and reassess your plan of care. You may have to modify, revise your plan of care as necessary. Constructive feedback. Sandwich the constructive feedback between the layers of recognition and positive reinforcement. Just keep in mind, constructive feedback is not a bad thing. A lot of times, we don't want to have, be, um, directed. I'll say that. So just keep in mind, so when providing constructive feedback, you are simply providing your evaluation of the individual's performance, not the character of that person. So again, we have to be receptive as nurses rather, to be in a position to receive constructive feedback. If not, you will not grow, you know. So when providing feedback or giving it, when you're providing it, make sure that the individual, they are listening, and the interview, if I'm receiving constructive feedback, I need to be an active listener and then focus on the facts. Don't take it personal. Again, like I said, it provides that individual, when you're giving feedback, constructive feedback, give that individual an opportunity to self-reflect. And then we need to support the individual. Okay, I noticed that you contaminated while you were inserting this folded catheter or whatever, an LPN or whomever. Tell them, be direct with them. It's nothing personal, Just let them know what should have been done, as opposed to as opposed to how they perform the task or whatever. So constructive feedback is very positive. It should be in a positive manner. It helps that individual to grow. So this ends chapter 11. I will upload this as well under the course in Canvas.